What's going on, everyone? Hey, so today's a special day because it's my birthday, but even more special, well, not more special than that, it's my birthday, but something else that's cool is I just got a phone with Dr. Miles Bodzin from Cash Practice, on a Sunday, and we use Cash Practice quite a bit. We use it for the wellness score, for the care plan calculator, for the drip education system, processing our payments, all that stuff. So anyway, he asked if I could put together some training videos on how we do our wellness score, which I've never done that before. And I was going to just do like a screen share and run through it and explain it. But you know that I don't like to do anything halfway. We'll say that, keep it PG-13. So I'll show you a sneak peek. And we're gonna make some full-on training videos on this, but I made all these slides. And the slides, let me just show you this real quick so you can see like a really sneak peek of what this looks like. All right, so you have wellness score, and then we go through and we show patients on the wellness score, and this is what the wellness score is. So basically our patients get like a portfolio of information pre and post care, and they get this really detailed report, but they put so much emphasis into the wellness score. And that's something that I was telling Dr. Bodzin when I was just talking to him, is I said, I don't think chiropractors understand the brevity, how huge, is that the right word? Brevity? I don't know. How huge the wellness score is for someone's practice. People want objective, measurable data. They want to be able to see where they're at. They resonate with the fact that they have a percentage in the score and it's competitive, and they want to improve it. Like, we've been using the wellness score for so many years that I kind of forget about how important it is and how other chiropractors maybe don't use this, but that's how we take all the things that we measure inside of Move Now University, all the objective stuff that we track, and that's how we present it to someone. So using the wellness score has been huge, and I think some chiropractors just think, oh, it's a little add-on, like it's a little application, it's really like the basis of what defines your entire practice in the patient's mind. So here, I want to show you a couple of these things because I just put a bunch of hours into it. I want to show it off before I make all my videos. So parameter 1 is a 12-week transformation engagement. And so our patients have access to this online membership site that you've probably heard about before. And all the Move Now doctors get a clone of this. They have a online membership site, and we basically grade their engagement on a 1 to 5 scale. So they start off at a 1 by default, and then at their re-exam or their comparative re-report, if they're engaged like this patient who actually wrote in here a ton, showed us this, followed all the online courses and whatnot, because we asked them about it, they talk about it, then this guy on his comparative is gonna be a 5. Okay, and then the next parameter is the 4 essentials. So the four supplements is a daily omega and probiotic and D3K2. Okay, so we talk about that. And what's this? Medications. The more medications they take, the lower their score. Okay, and okay, this is our movement assessment. And next one is belt system of functional movement. I haven't run through this yet, so we'll see if I have any typos. So there's a belt system that grades where they're at in their functional movement progression. They start at a white belt, so they get a score of a 1 when they start at a white belt. And as they ascend up, this improves their score, improves their overall grade. Translation distance head AP. Okay, so this is where we start getting into x-ray analysis, and I show you how we grade these. It's somewhat subjective. I try to be super analytical and go based on actual millimeter measurements. It just didn't work out. So I made it somewhat subjective, but I'm gonna explain this in these training videos inside of Cash Practice in detail. So just to clarify, these videos, once I make them, will be inside of Cash Practice. It will be part of their program teaching how these parameters work. Okay, and we show some like big head translations. These are actually pre and post, which is cool, right? These are pre and post x-rays of patients. All right, then we talk about how this is measured. It's utilizing chiropractic biophysics protocols of looking at C2 to T4 on the AP. And then we go thoracic AP. So this is something else that we measure. We use Posture Ray software to measure this stuff. So I went and drew on this with like some drawing tools just to demonstrate, but we actually use Posture Ray to to measure the thoracic distance, or translation distance thoracic on the AP. And then we just talk about some of the published research by chiropractic biophysics of how they go through and measure this. So you can get all the specifics from them. They have textbooks, they have online courses, or not online courses, they have videos of their seminars, and they have seminars that you can take. Scoliosis presence, this is on a 0 to 10 scale of scoliosis. It's somewhat subjective. Again, I try to use measurements, and it just wasn't going to work to make it completely objective. So there's a little subjectivity to what we call head, thoracic, and scoli. So head shift, thoracic shift, and scoliosis presence. Now here's where it starts to just pull stuff straight off x-ray. This is the sagittal x-ray analysis. It's all of this stuff. So you have anterior head, you have translation distance from thoracic. So here, I'll run through that. It's parameters 9, 10, 11, 12, and 13. We have 21 parameters inside of this thing that we built. And so basically we look at the lateral full spine. Again, we analyze that in Posture Ray. That's our x-ray analysis software. And then we run through and we talk about how we do each thing. So anterior head is C2 to C7, posterior inferior vertebral body. And then this one is a posterior thoracic translation, or anterior posterior thoracic translation. So it's from T12 to posterior inferior of S1. We're measuring, does it shift backwards or forwards? And it's this one right here. It's at negative 16. Okay. So T12 to S1, T12 to S1. Right. Make sure to, yeah. And 16. And it's an absolute value. So it's 16 millimeters. Okay. So that person got a 90% in that category. But then when you look at things like curves, you have sagittal curve the neck. So it's a posterior tangent of C2 to C7. It's a positive 6-degree curve. It's 115% loss. So look at that 6-degree curve. They got a 10% in that category. So they're not doing so hot there. Okay. They got a 24-degree thoracic curve. Should be a mid 40-degree curve. So they got a 10% there. Should have a 40-degree lumbar curve. They only got a 23-degree curve. So 50% there. All that stuff is derived off of this. Okay, cool. So anyway, next. Cervical flexion extension instability. Now this is, we use flexion extension x-rays on anyone that has an abnormal cervical curve or history of injury. We use Penning's analysis, so posterior tangent. We're looking for anything more than a 11 degree intersegmental flexion or extension angle. So those are flagged because you got 15.9, 15.5, and 11.9. So you got 3 areas that are flagged. So you see over here it says 3 segments are flagged for the x-ray cervical flexion extension instability. Less is better. That's a 50% score right there. You see how this all works? And then this is straight from Posture Ray instability report as well. And based on that, the alteration of motion segment integrity, the AOMSI guidelines, at the following levels, they have rateable instability, and this patient may be rateable for a permanent injury upon reaching maximum medical improvement. This is the case if it's like a personal injury case or some sort of trauma injury care. Next one is spinal palpation severities. This is a little bit of a subjective, but it's a 1 through 4 scale. We talk about what that is. All right, someone comes in, they're super acute and they're tender to the touch, and as they do better, their tissues heal, they're less tender, so they might start at a 4 and they might back off all the way to a 1. This one now, regions of decay. So we use just a simple model. I mean, obviously there's a lot of dynamics when it comes to disc degeneration, but we keep it simple in the sense that we follow the Gonstead disc analysis to D1 through D6. Anything from a D3 on, we list on the wellness score. And here's how we list it. I put a lot into this slide. All right, so this is how we count it. We actually note all of this. We put this together in our recommendation card under disc type. So we chart all that out, and then we write down areas of decay, that number 19 inside, and then that thing that's circled wellness score. This is a cutout of our recommendation card when we're mapping out care for a patient. Okay, and I'm running through this just bird's eye view, but this helps capture all the systems inside of Move Now University, and we do this in the wellness score. Neurological deficits, so if someone has sciatica or like cervical radiculopathy or headaches, Those are things on a 0 to 10 scale. How severe are their neurological complaints or findings? And then the last parameter is 18 through 21 is blood pressure, heart rate, body fat percentage, and waist to hip ratio. So these are things that we also track. And then it gives us a cumulative score right there, the 52. And that is it. So if you want to see how this all works and ties together, check out the demo.movenowyou.com. And if you are a Cash Practice member, you will have this inside there very soon. It's going to be called Move Now University version 1.0. It's going to be a parameter set. And to learn all the systems that come behind us, that's where we come in place. But this is like the light at the end of the rainbow. This is what you show the patient, what validates the care and makes it so significant to them, especially when they have a comparative wellness score. So I have this one pulled up. I'll show you this real quick. I didn't have this anywhere else, did I? Hold on. Let me get out of this, throw this up on my screen. This is where it's really cool, is when a patient goes through care and then you can show them this. You can say, look, you were a D. Look at all the stuff that was red and yellow and not good, and it all came up to a green. Now you're a B. You went from a 65% to an 86%. However, there's still some stuff that needs some improvement. Like you can see this here. You still have a 16-degree curve in your neck, which is better, but we want probably about a 30-degree curve in your neck. And so anyway, running through that can then, and then also like really cool here, belt system of functional movement. This person actually got really far through the belt system. They're up to a 4, which means that they got up to a green belt, which is hard to do. Takes some time. There's a green belt, so we have wristbands we hand out for these. They say results matter most. And our clinic's called Gonstead Spine and Wellness, so it says Gonstead Strong. It's got a little logo of our clinic and the logo of the 12-week transformation. Anyway, so it's just a cool thing to be able to show patients, keep them engaged, excited about care. Anyway, I gotta get going because it's my birthday. I got a birthday party going on pretty soon. But check out demo.movenowyou.com. Wish me a happy birthday. Check out the demo. We'll talk soon.